Hello, my name is Kevin Ohlendorf, and I'm the president of the Ohlendorf Appliance Laboratory. There are many different types of lower fixed expansion appliances that can be used to create better arch form, create space to uncrowd the teeth, upright the posterior teeth, and expand the lower arch. All of these appliances have unique features and uses. In this video, I'll go through the most common lower fixed expansion appliances that we fabricate and explain how the appliances work, their components, how to seat the appliances, how to activate them, and possible treatment times for each one of them. This video will provide you the information that you need to determine which appliance to use when you treatment plan your cases. Let's take a look at some of the lower fixed expansion appliances. This is the lower fixed SCHWARZ appliance. The parent or patient turns the screw to activate the appliance. The appliance will expand the arch and upright the posterior teeth. Even though the screw is in the anterior region, the heavy body wire distributes the force so the entire arch is developed. The fixed SCHWARZ is usually designed with bands on the first molars only. It's not necessary to band the first bicuspids or deciduous molars. You can add buccal tubes to the bands if you want to add braces later on. Usually lap springs are placed to help round out the anteriors as the arch is developed. They can also be activated to flare the anteriors forward at the same time. This appliance can be activated one turn twice a week. In adults, you may need to slow it down to one turn once a week if the appliance starts riding up the lingual of the teeth during treatment. We use an 8mm screw in this appliance. Each turn is a 1/4 millimeter, so you can turn the screw about 30 turns. The screw will come apart if it's turned too much. It will take about 3 to 4 months to fully activate the appliance. You'll want to retain the development for at least 4 to 6 months after the expansion is completed. You can leave the SCHWARZ appliance in place as a retainer or change to a 3D lingual arch. A Wilson 3D lingual arch works very nicely to hold your development and allow you to start straight wire treatment much quicker. If you're going to use the SCHWARZ appliance as a retainer, you may want to place acrylic around the screw to prevent the screw from backing up. The lower fixed SCHWARZ appliance is a very effective appliance to upright the posterior teeth and create space to uncrowd the arch. Another version of a fixed SCHWARZ is the 3D skeletal expander. Dr. J. Gerber developed this appliance, and it's a very effective way to expand and upright the posteriors in the lower arch. For this design, we use a smaller screw and cover it with acrylic. Some patients prefer this design because it's more compact. If the arch is really crowded in the anterior region, this design is better than the traditional SCHWARZ appliance. The smaller screw takes up less space and fits better when the arch is more crowded. It's also much easier on the tongue and frenum. This appliance is made to fit into Wilson 3D lingual tubes. The tubes allow you to remove the appliance without having to take off the bands. At each monthly appointment, you will want to remove the appliance so the patient can clean behind the anteriors. This also makes it much easier to adjust the acrylic. When you're finished, you can insert it back into the tubes on the molar bands. The activation and retention schedule is the same for this appliance as it is for the SCHWARZ appliance. We always fabricate the appliance with buccal tubes on the molar bands, so you can start straight wire treatment right away. The 3D lingual tubes are very helpful to transition from the expansion to the retention phase. Once you have completed the expansion, simply remove the appliance from the tubes and take an impression with the bands in place. Put the appliance back in to hold your expansion until the lingual arch is ready. When you pour up the impression, make sure that we can see the lingual tubes in the working model. We can fabricate a Wilson 3D lingual arch to fit into the tubes. This is a very effective and easy way to transition from the expansion appliance to the holding appliance. The 3D skeletal expander is another design variation that is very effective for crowded cases where there may not be enough room to place the screw that comes with the fixed SCHWARZ appliance. This appliance is called the Williams expander. It's mainly used in the early mixed dentition before the permanent first molars have fully erupted. The appliance works by having the patient or parent turn the expansion screw to widen and develop the arch. Since the first molars have not erupted enough to band, we place bands on the second deciduous molars and add an extension to engage the first molars. This will incorporate them in the development of the arch. You'll want to seat the appliance as one unit and with the anterior wire in place. The appliance should be activated one turn twice a week. This is an 8mm screw, and each turn is a 1/4 millimeter. The screw will come apart if it's activated too much. The appliance should be activated about 30 turns. This will take about 3 to 4 months to complete. You'll want to retain the expansion for 4 to 6 months, and you can use this appliance as the retainer or switch to a lingual arch. As the appliance is activated, the NITI wire will move forward and put pressure on the lingual of the anterior teeth. This pressure will help straighten them as you go along. The wire fits into tubes along the lingual of the appliance and is free to move. If the patient plays with this wire with their tongue, it may come out. You may want to place a small composite shelf on the lingual of the two most lingual anteriors to help hold it in place. If it comes out, you can easily slide it back into the tubes. The Williams expander works great in the early mixed dentition to expand the arch, create space to uncrowd the teeth, upright the posterior teeth, and begin to align the anteriors. A very popular combination is an upper removable SCHWARZ expander and lower fixed Williams expander. These two appliances can be worn at the same time and complement each other very nicely. This next appliance is called the E-arch or Arnold expander. It can be made for the upper or the lower arch. The appliance develops the arch using a spring-loaded split lingual arch housed in a tube. The tension on the coil spring is set when we fabricate the appliance, so it does not need to be activated. It already is when you insert it. The E-arch is fabricated with bands on the first molars, and we can add buccal tubes to these bands if you plan on leaving it in place once the expansion is completed. The open coil spring is the active force to expand, uncrowd, and upright the posterior teeth. This appliance can be difficult to seat since it's pre-activated. We recommend tying the appliance with dental floss or a ligature wire like we have shown in this picture. This will keep the appliance together and passive. Once you have cemented the appliance, you can cut the wire and it will start to activate. The E-arch removes all compliance issues. The patient does not have to turn any screws or do anything for the appliance to work. It will take about 3 to 4 months for the appliance to fully activate it. Once you have enough expansion, you can crimp the tube with a heavy wire cutter to prevent any additional activation. The E-arch should be worn for about 4 to 6 months after the expansion to maintain the arch form that you have created. Straight wire treatment can be started during this time to help speed up the case. The E-arch is a very good appliance if you are concerned about patient compliance. You do not have as much control with this appliance as you do with an expansion screw, so you need to monitor the patient very closely. The E-arch can provide good expansion of either arch and works nicely as a retainer to hold your development. This is the Wilson 3D Quad Action Appliance. It's the lower version of the multi-action appliance that I discussed in previous videos. The appliance is made of all stainless steel wires, so you'll need to bend the appliance in order to activate it. The appliance is very versatile, but I'm mainly going to discuss how to use it as an expansion appliance. The quad action expander can be expanded bilaterally, unilaterally, only in the anterior region, or only in the posterior region. You can selectively bend the appliance where you want the activation to occur. The quad action appliance fits into 3D lingual tubes on the first molar bands. The vertical slots allow you to remove the appliance to make adjustments without having to take off the bands. Place a scaler between the two posts and rotate it to remove the appliance. Once it's removed, you can activate the appliance and then insert it back into the slots. Most doctors will seat the appliance as one unit when it's first inserted. We will return the appliance to you in a passive state, so once it's cemented, you simply remove the appliance from the lingual tubes, activate it, and insert it back into the lingual tubes. You can activate the appliance about 3 to 4 millimeters at each appointment. See the patient about every 3 to 4 weeks to reactivate the appliance until the expansion is completed. It normally takes about 3 to 5 months to complete the expansion. If you want to expand the entire arch, you'll need to flatten out the lingual arch wire and expand the sweep arms. If you only want to expand in the anterior region, you can activate the sweep arms only where you want the expansion to occur. For unilateral expansion, only activate the sweep arms and lingual wire on one side that you need to expand. Once the expansion is completed, you can use this appliance as its own retainer. We always place buccal tubes on the retainer so that you can begin using straight wire at any point during treatment. You will want to leave the appliance in place for at least 4 to 6 months after the expansion to maintain the development that you've achieved. The Wilson 3D Quad Action Appliance has many valuable uses beyond what we discussed in this video. If you'd like more information about this appliance or how to activate it, we have a very good video about this appliance on our YouTube channel and our website.
Thank you for watching this video on fixed expansion appliances. I hope that you have found the information helpful. If you'd like us to fabricate one of these appliances for you, we'll need you to send us a set of upper and lower working models poured in yellow orthostone. We can provide the molar bands you need for the appliance, or you can pre-fit your own bands and send them in with the case. If you send your own bands, you do not need to pour them up in the working model. Send them along with the model in a plastic bag, and we will fit them on the model in the ideal position and then make the appliances. We have found that we can provide a better fitting appliance for you if you don't pour the bands in the working model. Be sure to check out our other videos on expansion appliances and removable expanders. They can be found on our YouTube channel and on our website. I hope that you will consider having us fabricate your appliances in the future. As always, if you have any questions about our laboratory or anything that you saw in this video, please contact me directly and I'll be happy to help you out any way possible. Thanks again for watching this video, and I hope you have a better understanding of the many pros and cons associated with these fixed expansion appliances.